My name is Dr. Brahim Abdurrahman. I'm a consultant gynecologist at King's College Hospital. I've been a consultant for 16 years and I've been practicing obstetrics and gynecology for up to 30 years. We're going to be discussing ovarian cysts and the various types of ovarian cysts and their treatment. Okay, classically when you look at any documentation regarding ovarian cysts, I'll classify them as benign cysts and malignant cysts. The benign cysts tend to be either functional cysts. These cysts are simple cysts, they're hormonal, they're part of the normal menstrual cycle. Every month, the ovary develops an egg, the egg gets surrounded by a bag of fluid, which can get quite big, and then open, the egg gets released, and this bag of fluid fills with blood and is called the corpus luteum. And this is used to support a pregnancy if there's a pregnancy. If not, it gets absorbed and then the cycle starts again. Now, when the cyst is full before the egg is released, that's called the follicular cyst, and it's a simple cyst. It's just got fluid in it. When it's present after the egg is released, if it gets quite big, it can be called a corpus luteal cyst. Now, in both cases, these cysts will resolve on their own. If we say a cycle is 4 weeks, then if we find a cyst like this that's less than 5 centimeters and looks very simple or looks like a corpus luteal cyst, we can simply rescan 2 weeks later, and if it is part of the cycle, it will have disappeared. So no treatment is required for that. There's another type of cyst called the dermoid cyst, which is known as a teratoma. Now, this is made up of tissue that you're made up from when you are still a baby in your mother's uterus. It's called ectoderm. Now, ectoderm develops lots of things. It develops hair, bone, teeth, sweat glands. So all these things can be involved in the dermoid cyst. The risk of a dermoid cyst being malignant is actually very low in a woman, whereas a teratoma in a man can be malignant a lot more. A teratoma doesn't always need treating. If it's 2 or 3 centimeters and is present for a few years and doesn't give any problems at all, it can be left. But if they become big, then like other large cysts, they will need a treatment, and that can usually be carried out laparoscopically. Generally, if a cyst is less than 5 centimeters, we do not rush to treat it, we reassess. But if it goes above 5 centimeters, you must be aware that because it's making the ovary heavier, there's a risk of it twisting the ovary. Now, when that happens, it twists the blood supply to the ovary and cuts it off. Then it becomes an emergency to treat. So if you have a large cyst and you get any sudden onset of severe pain, you must go to the hospital immediately so that then you can have a laparoscopy to correct the twisting and save the ovary, as well as removing the cyst. These are the benign cysts. There's also something known as polycystic ovaries. Polycystic ovaries is essentially a misnomer. We first named polycystic ovaries in 1935 when we thought these things were cysts. We now know the little eggs that have stopped developing. Polycystic ovaries is more of a metabolic problem. I really wouldn't recommend anybody going ahead and having surgery for polycystic ovaries. These cysts do not need removal. They never get to be bigger than 1 centimeter. It is more an abnormality of the metabolism and the hormones that needs correction, and the general treatment for that is weight loss, controlling the diet, controlling the carbohydrate intake, maybe taking further medications, hormonal medications to regulate the cycles and prevent the symptoms of polycystic ovaries. A fourth type of cyst is very common, is what's called an endometrioma. Now, this is because of endometriosis. Endometriosis occurs in 1 in 10 women. Occasionally, these ladies will get a cyst on the ovary, which is composed of the endometriotic tissue. It's often always also known as a chocolate cyst. Again, like with dermoids, if these endometriotic cysts are small and not causing significant issues and not causing any symptoms for the patient, no active treatment is required. But if they're big or they're significant and giving other symptoms related to endometriosis, then they need to be treated. Ovarian cysts can be one of many types. They can be benign or malignant. The benign ones are usually either what are called functional ovarian cysts, endometriotic cysts, or simple cysts, or what are known as mucinous cyst adenomas, which again are not cancerous, but are significant cysts that can grow and persist over time. A fourth type is polycystic ovaries, which is a misnomer because these are not really cysts, and we can discuss that in more detail. Ovarian cysts can present with many symptoms, but the classic ones are abdominal pain in the pelvis, bloating, and maybe gastrointestinal issues if somebody has constipation or something like that related to issues because of the cyst. Much more significantly is severe pain if the cyst ruptures or twists. In the vast majority of cases, the causes are hormonal. Occasionally, they can be related to genetics. For instance, one of the cysts we mentioned is a dermoid cyst. A dermoid cyst originates from tissues you made up when you're a baby. It's not related to hormones, it's just something that develops over time. And again, it can be related to medication intake. For instance, patients having treatment for infertility can get stimulation of the ovaries to cause a cyst. With polycystic ovaries, the treatment is really medical, not surgical. With endometriotic cysts, if they're small, if they're not causing symptoms, you do not need to do treatment. If they are causing symptoms and they're small, you can try medication, which will help shrink them down. There's a medication called Visan, which is specific for endometriosis and may control this. If they are significantly big, then obviously surgery is indicated for these. And that can be done with keyhole surgery, which is known as laparoscopy, where we put a telescope in, remove the cyst, repair the ovary, and that's it. Treatment for most large cysts should be carried out laparoscopically. We're really past the stage now where somebody needs an open surgery to remove a cyst. The only case where we may consider open surgery to remove the cyst or open surgery to assess the pelvis a little more are if the cysts are considered to be malignant. We are concerned about possible rupture of the cyst, although nowadays we can also remove these cysts as part of a removal of the ovary and get them out in a bag by keyhole surgery. People having medication or people who've had a previous ovarian cyst, if you've had a cyst, you're more likely to get another cyst. If the fertility treatments you're having are quite strong, then you're more likely to get cysts. Occasionally, you can get very large cysts with fertility treatment known as ovarian hyperstimulation. Again, that is not treated surgically, that's ideally treated medically, but can be quite a serious condition.